Hello, it's Dr. Rhonda Johnson. Today is Sunday, December 17th, 2023, and today I'm talking about measles cases in Europe. Well, did you know that measles cases across Europe have risen 3,000% between January to October of 2023, according to the World Health Organization? Well, more than 30,000 infections were reported between January and October of this year. That's compared to 941 cases of measles in Europe in all of 2022 last year. Now, among these 30,000 measles cases, there were 20,918 hospitalizations and 5 measles-related deaths. Now, all age groups were affected, with 2 and 5 out of the cases being among children, 1 to 4 years of age, and 1 in 5 cases were among adults, 20 years and older. So here we have measles, the most contagious disease on earth. A little bit of background. It spreads through the air when an infected person coughs or sneezes. It's airborne. In fact, the measles virus can stay in the air for up to 2 hours after an infected person was breathing in that airspace. And anybody that walks into that airspace can get infected. In fact, measles is so contagious is that if one person has it, up to 90% of the people close to the infected person can also become infected if they're not protected. Now, there's no cure for measles. Treatment is supportive, and vaccination is the only way to protect you from measles. The vaccine is the MMR, stands for measles, mumps, and rubella vaccine. Measles is a vaccine-preventable disease. So what are the signs of measles? Infection usually occurs within 10 days of exposure. You can have fever, you can have flu-like symptoms, runny nose, cough. You can feel really tired. You can get white spots on the roof or inside of your mouth, a red spotted rash all over the body, all over the skin, and the eyes can turn bloodshot red. Now, measles can be complicated with pneumonia, so complications of measles can include pneumonia, meningitis, an infection of the brain called encephalitis. You can have blindness as a complication, seizures, and even death. So don't underestimate measles, folks. Again, when should you get the measles vaccine? The CDC recommends all children get 2 doses of the measles, mumps, rubella vaccine, starting with the first dose at 12 months through 15 months of age, and the second dose at ages 4 through 6. And in outbreaks, children can get the second dose earlier, as long as it's 28 days after the first dose. And if you're an adult and you did not get the measles vaccine, to your knowledge, please talk to your doctor about getting a catch-up measles vaccine. I'm old enough that I remember my measles infection as a child. I remember being so sick, and I remember having fever, and I remember having hallucinations. So again, I have a healthy respect for measles, and it's nothing to take lightly. Take care, folks. That's my message today, and as always, be safe and be well.